We are here at Eyecelerator 2025, joined by some illustrious panelists. Very excited today. Ali, how are you feeling?
Doing great.
Great. Daniela, how are you doing?
Excellent. I love Eyecelerator.
Awesome. And David, first Eyecelerator.
It is the first. This is exciting, and I'm glad to be here.
Let's start off. Is 2025 the year where we see AI and oculomics go from concept to large-scale implementation? I ask you, Ali.
AI has been advancing very rapidly, especially since the pandemic hit. But really bringing it to life requires partnerships. It requires investments in innovators. It requires disruptors to be bold. And it requires alignment with different stakeholders. And I believe that this is the year where it's all coming together. And it's not only going to be a reality, but it's going to scale at an unprecedented rate.
Topcon and Microsoft are joining forces in new ways this year. How is this collaboration helping accelerate progress, both in the technical innovation realm and also in the way that care is delivered?
We want to help them by enabling them with the technology, bringing together a partner ecosystem, and helping to transform the way that care is delivered. And we're doing all those three things with Topcon. We are enabling the technology to be more seamless. It's now being brought into the cloud. It's more secure. And part of what Microsoft's been building are foundation models that could be used for accelerating research, building agentic models that allow us for increased workflow and efficiency, and even models that allow us to be able to provide this directly into the workflow within the clinical care. So by combining all the things that we're working on and our partners are working on with what Topcon creates real synergy. We now have an opportunity to do things that individually we would have found difficult, but together it's going to be a lot easier.
What conditions and diseases do you see as being impacted early on by oculomics and AI?
We physicians are actually used to do oculomics, for example, through diabetic retinopathy. Now, what AI can do is twofold, is do this at scale with less training, so we can really democratize early detection and better care. But AI now can really push to the next level, which is biomarkers and scientific understanding that my human eyes or my human brain cannot process. And in a very quick eye exam, safe, non-invasive, fast, cheap, you can see vessels, you can see nerves, you can see manifestations of inflammation, you can see metabolic manifestations, you can see signs of aging, oxidative stress, and the list goes on. And we're barely scratching the surface of what's possible, because now, again, with better systems that can collect large data sets at scale, automated collection, good data sets for AI, then we can really unlock scientific breakthroughs simply by looking at vessels, nerves, cells, and the sky's the limit.
With IDEA, IRIS, and the Alliance for Healthcare from the Eye all advancing in parallel, how do these initiatives come together to improve outcomes for patients and help clinicians make faster, more informed decisions?
Iris is a company that has been pioneering for now 13 years the idea of putting ophthalmic diagnostics in primary care facilities. The acquisition of Iris was really intended to help them scale that by introducing AI into their workflows. IDEA, Institute for Digital Health, the intention of launching that at ARVO this year was really to democratize access to AI-ready data sets. We have an engine that allows us to help these innovators to get regulatory approvals, and we have a commercial engine that allows us to deliver it to primary care, to optometry, and to ophthalmology. And so IDEA was really meant to ensure that we accelerate that process.
So think of the Alliance in terms of not just using oculomics to diagnose or identify a disease, but the goal is to bring the individuals to care in a timely manner. It could reduce the costs of care, it could increase access to care, and it allows us to be able to have a better delivery system. In terms of reducing cost, 5% of individuals account for 50% of the total cost of care. But the problem is, by the time you identify those 5, it's too late. We have an opportunity with Healthcare from the Eye to find those 5%, get them to care, and get them on track to be able to never have those outcomes. That would be massive in terms of both clinical and financial outcomes. In terms of access to care, We don't have to rely on people to go to the doctor's office or clinic with healthcare from the eye. We can push these technologies out so that they can go to places that are much more convenient. It could be part in their neighborhood, in a retail store. It could be potentially even in the home. Lastly, we have a shortage of clinicians. If we can find a way to make sure that the sickest of the sick gets seen by the specialists, but everyone else is managed in a way that we can increase the optimization of the workflows, we then have a more efficient system so that people can take advantage of it. And I think all three of those are possible with healthcare from the eye, which is super exciting. And I anticipate we're going to start seeing some significant results within the coming years.
Daniela, Topcon systems now connect devices, data, and AI through an open ecosystem. Can you tell me how these elements working together to make healthcare from the eye a living, functional model of care?
So we physicians are data-driven decision makers, if you will, and non-rarely we're completely disconnected from patient data. We know that patients, when they go to the office, we collect some important clinical information, but that's a snapshot of a patient life or patient exposure. Really what we're trying to accomplish is, on the one hand, scientific breakthroughs. Oculomics is the next frontier for drug development and for patient care, but we also need to take care of the basic connectivity and make sure the systems talk and make sure that big data scale is accessible for clinicians and for researchers. So we want to help through this connected system, make sure that real-world data and clinical trial data can be both leveraged at the same time for scientific breakthroughs.
Why would you say this openness is so important for scaling innovation and ensuring that patients everywhere can benefit regardless of what tech they use?
If we really want this to be tracking across the entire healthcare ecosystem, it's really important to be open and have an open platform that can ingest data from any technologies and deliver it. Industry has to put their technologies and their mindsets together and align them to make this work, because it will change how healthcare is delivered. It will improve access to healthcare. It will reduce the cost of healthcare, and it will ensure that we don't have a fragmented healthcare system. I think it's going to be important to eventually bring what today are perceived as our competitors into this alliance and make sure that everybody is thinking about the same problems to solve. Whether you're a primary care provider or organization or optometry organization or ophthalmology organization, I think you need to make sure that you understand how you're impacting the whole health system. And to do that, I think you have to be working with all industry partners, competitors or not. And we launched this initiative with the intent to bring in what today is perceived as competitors, but really we're all on the same team when it comes to oculomics, because it's such a, I would say, ambitious goal to deliver this at scale that we need everybody in the room to talk about it.
How will we know when healthcare from the eye has truly become part of mainstream medicine?
We've been focused in the disease. We want to focus on the health span. So when we know that oculomics became a reality, when we're ahead of blindness, when we're ahead of very serious systemic diseases, that means early diagnosis, that means help the patient to navigate healthcare. When we are serving patients, making good use of data and helping them early on, that's when we know we got there.
When eye care is referring systemic disease patients to primary care, and primary care is reciprocating that by sending eye disease to eye care, and they're working in tandem. Matt, I would add to that, without Microsoft, we wouldn't be this bold about what we're trying to do and going all in on delivering oculomics through the initiative that we call Healthcare from the Eye. It really took not only an IT infrastructure company, but someone, actually, I wouldn't even say someone. It took David Rhew to help us bring it here and bring it to life. I would not be able to confidently stand up on any podium and talk about this unless we had the Microsoft partnership and David Rhew as our partner in crime.
Thank you very much. Appreciate it.
If this oculomics stuff works, funky jackets all around. You guys got them.
Nice.
Yes.
All right. Well, cheers, guys. Thanks so much for joining the program. It's been real.
Thank you.
Thank you very much.